launch opening new programs with virtual visits. We just met with our staff at 8:30 this morning to officially launch that and kick that off. So you should start hearing that new programs are starting to move through the licensing process. And right now, our direction to our staff is that those visits are virtual. And once the PPE arrives, then we'll look at what that would look like and what PPE is absolutely a minimal required for every visit. And the other thing that we let our staff know is that that's the guidance as of today, right? We're having to be flexible as things change and as needs change with the communities or needs change with the virus. So as of today, the guidance we're giving them is that we're opening new programs virtually only, and we're going to give that a try. And if we start getting feedback from our staff that there's a lot of barriers or that there's concerns or that it's just not working, then we'll revisit. Whether or not we have PPE, we'll revisit and see where we need to go with it. But we just know that we do need to start getting some of these programs through the process, especially because, our dreaded fall rush, the busy time is coming. And if we have a backlog of new programs that have been trying to get through, that we're just setting ourselves up for a really difficult August and September, which is probably going to be pretty tough anyway. So, because of that, I know that there are some CCRNRs, and Margie, this is where I was hoping you might be able to jump in a little bit, that there are some CCRNRs that are already offering a virtual introduction to registered family. And so Margie and I have been having some conversation about what that would look like to make sure that those are being offered statewide. So Margie, do you have anything to add about that?
Well, just that we know that there's some already being offered. We did send out the guidance as far as using all of the materials that have been designed and created for this and just offering all of that virtually. And that right now they were being done based on, some programs that were able to get licensed. And that was in connection with the licensing specialist. So the licensing specialist is able to let the CCRNR know, we do have some providers that can get licensed. They don't need a visit because they've already had one. So kind of in that, in those criteria that we were able to move that forward. But now, knowing that providers will be getting licensed, I think all of the CCRNRs offering this on a regular basis, setting up these trainings, and then staying very closely in touch with your licensing specialist to kind of know, what it's looking like is important. But there was also, Tammy and I were talking, and Tammy brought this up, and I know this is also on everyone's mind. There's also the need for those who perhaps cannot attend remotely, and wondering if any CCRNRs have thought about providing what that would look like, how providers could be supported with this Part 2 IRF training if they do not have remote options. Eva.
Thanks, Margie. I would just say that we would really like to get to a place where even if we delivered these one-on-one for people that couldn't attend remotely, we would need some guidance from the early learning division to say that that's a need. Otherwise, being in the system that we are with a K-12 as our backbone agency, we're really stuck with trying to figure out how we fit in that system, and we also fit the needs of our providers. And I would also really emphasize that we have providers that need us one-on-one, and we wouldn't want to be having big groups, but we really need that push because we have providers that are not accessing things remotely. And I would say not only for intro to registered family training, but also for training to renew their licenses, especially some of our Spanish-speaking providers.
Okay. Okay, so you're referring one-on-one, face-to-face, where you meet, social distance, mask, that kind of thing. That's what you're meaning.
Yeah, thank you.
Okay.
That's clarification.
Yeah, okay, thanks. Okay, that's something that we can definitely bring back and talk more with, of course, our Office of Child Care and our leadership. Anyone else, thought about a good way to do this? It can't be done virtually. Okay, I'm not seeing any hands or messages. Okay. All right, Tammy, did you have anything else you wanted to add regarding the virtual IRS too?
Well, closely related to, and please, let me know if you have any questions, but closely related to beginning to license new programs, then you go, well, what about first aid and CPR, specifically CPR, because that one the rules require has an in-person component. And what I can tell you is, as of right now, today, July 21st at 10:10 a.m., we're still requiring that first aid, or that CPR, have an online component. But what I do know is that Amy Joyce and Joan Blau are pulling together a discussion to see what options that they would have, that we have, whether we want to consider online as an only option, or whether we want to say, yes, in-person needs to continue to happen, and where that's going to go. So I'll say more to come on that. I know it's being talked about and worked on, but as of today, right now, we're still saying you have to have an in-person CPR. Is there any questions about the launch of this and what it'll look like?
For the notes, Tammy?
Sorry.
Yeah.
Can you guys hear me?
Yeah. Oh, Sydney. Yeah, go for it.
Okay, sorry. Go for it. Just for the notes, I heard you say, as of right now, we're still requiring that CPR have an online component. Is that what you meant?
Yes, that CPR has an online component, okay, and that we're having discussions to see whether that's viable moving forward.
Okay. Just making sure I have it in there correct.
Thank you. Any questions on that on CPR first aid? Okay. Thank you, Tammy. So I'm not sure, Tammy, if you want to talk about the policy for providers to notify parents, or do you want me to pick up on that one?
Well, how about if I start and you can jump in?
Thank you, yeah.
So if you look at our guidance document, the safety procedures and guidance for child care facilities, the document that we put out in conjunction with Oregon Health Authority, what that document says is when there's a confirmed case of COVID within the facility, that the program needs to, in the words that you communicate in coordination with local public health, with all families and other individuals who have been in the facility in the past 2 weeks. So local public health is really guiding who should be communicated with and when, and they're providing that information to providers. What I can tell you is that we do have some rules around it, but our rules are really interesting. One reason that they're interesting is because child care centers are written differently than certified family and registered family, which doesn't make it easy. In certified centers, it talks about an outbreak of a child care restrictable disease, which COVID is classified as a restrictable disease. And in certified and registered family, it talks about an outbreak of a communicable disease. Well, communicable disease is just about anything. I mean, that can be a common cold, and we knew when we were working on the rule review process that those needed to be fixed and aligned. So COVID is both restrictable and communicable, but then the rules talk about there has to be an outbreak. So then you have to look and see what the definition of an outbreak is. An outbreak means 2 cases from separate households associated with a suspected common source. So if there's only 1 case in a center, our rules don't require parent notification, but I know that public health is working with providers, and so public health is going to provide that guidance. But if there are 2 cases from separate households, Then for centers, what the rule requires is that they post it for parents to know. And for certified family and registered family, what the rules say is that parents shall be informed of it. So it's a little bit tricky, and what I would encourage, if you get any providers that call you asking this question, refer them to their licensor, because their licensor really is going to be able to dig into the rules and what the requirements are. But also, first and foremost, we're deferring to local public health, because they're really the experts on this. We're the licensing agency, they're the health experts, so we really defer to them and their expertise on who needs notified and when they need notified. Margie, did you have anything else to add to that?
That's great, Tammy, great clarification. I did just want to add that when there is a situation where it does not fall within the rules of OHA, health department, local health department, or Office of Child Care, that the providers would have some kind of policy, we would hope a policy manual that talks about when to notify parents for something, but kind of guiding them in following what their policies are, as well as what their own, sense of what is right to do as far as communicating with parents. So just kind of, I'm sure that's something you've all thought about, but we would want to make sure that they err on being supportive of parents knowing what's happening. And they're also following their own policies. Just keeping that in mind.
And if there's a confirmed case, even though it might not be classified as an outbreak, local public health is going to be saying you need to notify everybody that's had contact with that confirmed case and quarantine them. So it's going to happen, but like I said, we just do rely on local public health to provide that guidance.
Great, thank you. Are there any questions, thoughts? All right, it's a midsummer group, I can tell. Okay, so that was actually one of the Shakespeare plays this year, but we won't be seeing it. Let's go ahead and, yeah?
This is Lauren, sorry. I was typing too slow, and then you moved on. So just to clarify what you were saying, because I'm getting this question quite a bit on the helpline. If the provider kind of ultimately feels like the best thing to do is to let families know there's a case or a suspected case, they're free to do so if that falls within their own sense of how they would operate their program. Did I follow that clearly? That they don't have to, but they can.
Right, so we always have to remember that the rules are like the base level foundation, and if they have a policy that goes above and beyond that, they are welcome to do that. And I agree. I mean, if your gut is feeling like, gosh, I have 2 kids with a fever, but I don't have any confirmed cases, but I feel like I want to let parents know, so then I'm being transparent, you absolutely can. And I agree with the comment. Parents would be quite upset if they found out about a COVID case and weren't notified. And that's why I was saying public health is providing that guidance. And I think that even though the rules talk about there being an outbreak, I think that it's best to err on the side of letting parents know so that they can make informed decisions.
Thank you so much.
Great, thank you, Tammy and Lauren and Mary Wolf for your comment. That's great. Okay, so let's go ahead and move on. Joan, you want to talk about where we are in the process with the new child care guidance?
Yes. Good morning, everybody. So we have finished a discussion draft of the guidance. It went for translation yesterday morning. We anticipate getting it back by close of business on Wednesday, and then our plan is to post it Thursday morning on our website, and it will be posted in a similar format as to how the guidance was posted in the lead up to the creation of the new guidance, where there will be opportunity for anyone that wants to look at the discussion draft and offer comments will be welcome to do so. And the plan is to have it open for comments through Sunday. And then today actually, Amy Joyce and David Mandel will be presenting an overview of the most significant changes and the justification for those changes coming from, you'll remember our principles, really the science around child development, as well as the science associated with COVID-19 and what we're understanding about it, and how it manifests in group settings. And then also some of and of course the feedback that we've gotten from stakeholders and how that's influenced the changes. So today at the Governor's Health and Early Learning Council, the most significant changes in their justification will be presented by David and Amy. And then, so let me pause there. Any questions about any of that, where things stand? Okay. One thing that we would like to do is offer the opportunity to the Directors Association to identify up to 4 directors that would participate in a small focus group with myself and probably another community systems team member, just to talk through the new guidance. This would be something that we would be trying to schedule for Thursday or Friday or Monday morning of next week. Probably looking at like a 45-minute conversation. And we're particularly interested in directors who represent, you know, obviously a large metro would be very helpful. Folks who are working in the frontier and rural areas, which I understand is a large portion of the state. What the conversation would be about is really, what about the guidance isn't clear enough? You know, what are ways in which you think we could make this clearer than it is right now? We're not at the point where we're going to be making changes to the guidance at this point. Want to make sure by having conversation with you and other stakeholders that we are really talking with people who will need to support either will need to implement the guidance or will need to support the implementation of the guidance. And so we're hoping that you all could have a little conversation amongst yourselves and make a decision, and then let Margie know what 4 people, up to 4 people you'd like to recommend. And obviously you all can look at the guidance up on the website and you can see what it is, but we just need a smaller group to really have a more in-depth conversation about the guidance. And then we are on track in terms of finishing up and publishing the guidance as adopted by August 14th. So we're still really in the process here of getting to our final versions. We anticipate that we will have calls for childcare providers next week. Today, I think we'll be making the decision about what kind of format those calls will be offered in, and then we'll start communicating about that as well. So I think that's all I wanted to say about the guidance, unless there's other questions.
Not seeing any hands or text or chats. So, okay.
Okay. Do you want me to talk about the last item
yes.
there?
The proposed reductions. Yeah. Thank you.
So you'll remember that we were in the process before the legislature got involved. We were in the process that was really directed by the governor's office, and the governor's office had a limited amount of things that it can do to actually direct us to look at cuts. And so, you know, we went through that process. We had to identify different cuts. Now the legislature is going to be having its special session, and yesterday they published their proposed cut list, and included in that was the suspension of focused childcare networks for the second year of the biennium. So we are going to be working to put together some information that we'll be sharing about what the impact of this would be, and why we would very much not like to see it happen. And then we'll also be, I'm sure, talking and working with all of you around opportunities for educating people who might be making decisions associated with these cuts. And we'll be looking at what our capacity is to ensure that we're able to support you going forward with this important work. So it's kind of a three-pronged approach. You know, we don't, again, these are just proposed at this time. They're not necessarily made, but of course the legislature has many more tools at their disposal to be able to direct this kind of reductions than the governor's office did. So wanted to make you aware of that. I'm happy to take questions. I don't know if I'll be able to answer all of them, but I'm happy to take them.
Are there any questions? Jerry.
So I'm wondering about the timeline for, I mean, if in fact these cuts do happen, that impacts staff, and at the same time we are going to get these new positions, and I'm wondering how those things overlay. I mean, I hate, to be having people who are trained as focused network provider, technical assistant, and hiring for another job. So what do we think is going to be the legislative, when is the legislature coming back? When might we know when this is happening?
There's committee hearings this week, as I understand it. I don't know. I think the final decisions, as I understand them, would be made in August. I don't know specific dates. We can investigate further to see if we can find out. I can definitely appreciate your perspective related to the funding that's coming for preschool promise positions and et cetera. So obviously we will be trying to work all that through, because we're thinking the same things that you are associated with that.
Thank you.
Yep.
Taya Jocelyn. Thank you, Jerry. Taya.
My question is pretty similar to that. That's what I was going to ask Jerry, but I guess I'm wondering on the ELD's end of things, and just like the timing, as far as like we know there's an amendment coming. Is the ELD planning to wait to see what happens legislatively with that funding before we see the amendment coming through with preschool promise, or should we expect to see maybe two different ones, or do you even know?
That's a good question. We are definitely working on the amendments associated with preschool promise. We are not going to pause on that. So I think we'll have to see what happens, Taya, in terms of how quickly we know about these other things, because amendments take a serious amount of time to get through procurement. So we don't want to wait any longer than we have. As you all are aware, we've been in a bit of a pause because, of course, we didn't know what was exactly happening with SSA, and so, but now it's full court press, game on, so things are, we actually just had a meeting before this meeting to talk about that amendment. So we'll see what happens related to the timing, but that is, we're going to try to move that as expediently as we can.
Okay. Thank you.
Mm-hmm.
Thank you. Any other questions? Mary.
This is just going back to the guidance. I have a meeting at 1 with some county members, and I know they're going to be interested. When will that be posted, the new draft guidance?
Thursday morning.
Thursday morning. Okay. Thank you.
Yep.
Okay. Any other questions? Yes.
Yeah, I have one. So Joan was talking about, I don't know if I wrote these words down right, but today the Governor's Health and Early Learning Council are going to get a presentation. Is that going to be live streamed, or is that something we just wait to hear about?
Yeah, that's not considered a public meeting, so there will be no live stream. There are childcare providers that serve on that, so I would imagine they will be communicating.
Okay.
Any of you that are aware of Facebook for particularly AFSCME childcare providers, I'm guessing that either during the health meeting or after, you'll be able to find out what's going on.
Thank you.
Thank you. Okay, Tammy, you wanted to share more. Is that correct, Tammy?
Yeah, I wanted to do one more follow-up. Sorry. So when I was talking about the notifying parents, I feel like I got a little too hung up on the wording in the rules, and then I was thinking about the exclusion guidance. And while we know that when a program calls the local health authority and reports a confirmed case, the local health authority is going to tell them they need to be quarantining the entire group that had contact with that individual. One thing that we are hearing is that, as we can imagine, the local health authorities sometimes are very overwhelmed, and the response isn't happening maybe as quickly as would be helpful for the provider. Since our exclusion documents do say that they need to be quarantining the group for 14 days, they should be going ahead and reaching out to the parents and doing that even before they've heard from the local health authority, if they haven't been able to get in touch with them quickly. And so I put that in the chat box too, just to, as a reminder that, you know, they should follow that exclusion guideline, which would require them to notify parents, even if they haven't had the contact with the health authority that they've needed.
Great, thank you, Tammy. Okay, are there any other questions for Tammy or Joan at this point? Okay, I'm not seeing any hands. So we are moving forward quickly. What I'd like to do is invite any of our partners, if you have any COVID-related updates that you want to share with all of us, that would be great. So I know we have Melinda, Inclusive Partners. Do you have anything you want to share? It sounds like you're typing something.
No, nothing in particular, other than we're continuing to work on being creative and supporting providers. We've been doing some observations via FaceTime and some Zoom and that kind of thing. So we're continuing to do what we can.
Okay, great. Thank you. 211, do you have anything you want to share?
I guess two things. We have a community engagement specialist position open at 211, which will be somebody that lives in each specific region of the state, which is kind of exciting. Some of the CARES Act funding went to us. So we've got, for a year, we're gonna have some in-person people, in-person representation of 211 in, I think it's 10 different regions throughout the state, and we're hiring for those right now. So if you know of anyone that would like to do outreach around 211, not specific to childcare, but just in general about 211, take a look at our website and encourage them to apply. And then also another thing that I've been emailing a little bit back and forth with Margie about is that parents have been calling asking about whether or not their children can be in childcare, not because the parents are working, but because they want to socialize their children. And they're starting to get worried that they haven't been around other kids. And so they're asking now, as things seem to be sort of opening back up, even though the numbers are getting higher, they're asking if they can have referrals because they just want to socialize their children for a few hours a day.
So Carrie, I'd like to directly address that because we actually talked about that at our COVID-19 leadership team meeting last night. I'm sure I'll talk further with Margie about this if need be, and of course she can circle back. But I think we don't want to be in the business of deciding of making a judgment about whether or not people should choose childcare. And we are not operating under the original conditions we were, where we need to only be serving children of essential workers. So I think our position on that is that if your staff needs some talking points or ways or resources to help support families to understand, the implications of that decision of using childcare during this time, like we'd like to talk more about that. But I just think fundamentally, we don't want you to be screening out in any way people who are calling to ask about childcare at this point, unless something changes in the emergency situation where we would need to do that again.
So at this point, we'll just provide referrals to anybody that asks, and we'll send them the information that talks about safety, and then they decide from there.
That's exactly right.
Okay, thank you.
Yeah.
Yeah, and just so everyone knows, Sherry was able to attach the link to what families need to know to every referral. So every referral that goes out includes that link. So just like they have all the information on finding quality childcare and what to look for, they now also have what families need to know regarding childcare. Excuse me, and COVID-19. So great, thank you. DHS, do you have any updates? I thought I saw Alma on. And Regina?
Hi. Yes. Good morning, everyone. We don't have anything big. I know we're still having talks on our team about the CPR first aid issue, and we're going to be working with Amy on kind of aligning with their guidance, which I think they're still determining. So we don't really have anything to report out for this week.
Thank you, Regina. Pam Deerdorf, do you have anything that you want to update on COVID-19 specifically?
Surprisingly enough, I do not have any COVID-related updates.
Okay.
I could certainly talk for a long time, you know how that is, but I don't have any. Thanks, Margie.
Thank you, Pam. Sure, thank you. So anyone from TRI, anything you want to add, updates right now?
Sure, Margie, this is Robin. Sherry asked me to remind the directors that she's needing names of folks to help on the WLS rollout. And so if you haven't sent your staff name to her, please do. If you have more questions, you can reach out to me or her about sort of that responsibility level that she talked about last week.
Great, thank you, Robin. Okay, so we're moving through our agenda quickly. We're ahead of schedule. We do want to get into talking about Preschool Promise and those positions, which will just involve the CCRR directors. And then, of course, we would like to have Robin, if you could stay, or Hannah, someone from TRI, just to have that representation. Oh, and Grant, I'm sorry, Dawn has a grant update. So Dawn, sorry about that. Yeah, let's hear the grant update, and then we'll go ahead and change to a short break. Thanks.
Okay. Yeah, thanks, Margie. So I just kind of an update on numbers, and I'll go to phase 1 and then switch to phase 2, so to try to make it less confusing. So we are currently working through getting grant agreements with providers for the grant, for the phase 1 grant. We've reached out and are making the phone calls to everyone and kind of working through those. I didn't have a chance to pull a number of those, you know, how many there are, but we are working through that and making contact with them. We have to date awarded 1,843 grant awards and not approved 137. And you know, these numbers are always fluid. We are sometimes getting new information that maybe they should have been approved. We have also are having we've had 20 people decline the grant agreement. So that's kind of where we're at. We are, for phase one, we are continuing to review and work through the report one for their second payment. And in the next few days, we will be able to send out a good sized batch for the third and final payment for phase one. And then so on for phase two, kind of the update is we have not been issued any grant agreements, but those are getting also ready to get pushed out in the next few days. And that'll be, we've awarded 811 so far. And so that's who we need to get grant agreements out to. And then we still have 428 that are still in a review process. There's some information that we got that was flagged that we need to take a closer look at and see, you know, where they're at. So that's kind of where we're at. Again, these numbers are always fluid as we're working, you know, daily, like we have a daily project pretty much to go in and review a certain aspect and a part. So I know a lot of you guys have asked for data. And again, I think it's really just looking at, you know, what are you specifically needing it for? And I can definitely help to get that information. I think we talked 2 weeks ago when I was on the call that, you know, I think the list can be helpful, but that it really, depending on what you need it for, you have to kind of understand what the data is. So I can help with that if you have certain projects or things that you're working on. Questions?
Okay, I'm not seeing any hands or chat. Dawn, that was great. Thank you so much for that update. Yep. We did have one message from Lauren asking about guidance on the website informing programs that they need to contact their licensor and public health if they have a confirmed case. Do we have that on the website? And I am not sure. I'm not sure if anyone from ELD knows that, but we can certainly get that to our communications department. Okay, it's not looking like it. Anyone really knows, or we haven't had a chance to look. So thanks for pointing that out, Lauren. All right, so let's go ahead and take
Margie,
5 minutes.
I saw Karen had her hand raised.
Oh, who did? I'm sorry.
Karen Hinkemeyer.
Oh, Karen, I'm sorry. Go ahead, Karen.
Hi, I don't know exactly where all these fit in, but one, before Pam leaves, I'm just wondering if the CCRRs are able to get the list of individuals who've been approved for scholarships so far, just so that we have them instead of people reusing their voucher when they don't actually have anything left. I don't know if I'm phrasing that right. Jessica can step in if need be, but we just want to make sure that we can bill for the individuals that have said we can bill. Does that make sense?
Yes, let me check on that for you. I will check on that and get back to you.
Yeah, I think we've asked for it in the past, but because of confidentiality, we weren't able to receive it. But, you know, we already are in Oro, we're partners, so I'm wondering if we can work through that barrier. The other questions, so just to give this out there, we have had some providers ask us a couple of questions in regards to guidance. One is we have a provider who is struggling that she's required to live and reside in the house where she cares for children when her family is compromised. And yes, we can tell her she should just close down, but that would then give a huge deficit in childcare. So I'm wondering if that's been thought about, talked about, can providers that are CS or RF reside in another location during the pandemic to keep their family safe? That's one question. Second question is, we're receiving requests from providers of how best to work with the influx of school-age children in their programs and working them through the system of doing online school. And yes, we're meeting locally with our school districts, but I think on a whole, this is something that it would be great if we could talk about so we're all kind of understanding what people are doing and maybe we could help each other. So just those two things.
Okay, great, Karen. Thank you. I know that has come up before. I know a couple of directors have talked about the school age children. So, so let's hold on to those two talking points. I'd like to revisit with our team, community assistance team, and talk through the best approach. And then also get to Office of Child Care. I see Tammy is no longer on right now, but asked the question about changing residences. So during this time. Thanks, Karen. Anything else? Anyone? All right. Well, let's go ahead and take a 5-minute break. We reconvene with the directors and a representative from TRI, and we'll dive into more conversation about Preschool Promise. Thanks. See you in 5. Hi, everyone. Welcome back. We'll give everyone just a couple more, or another minute maybe, get some of our faces on. That way I know you're back. Okay, well, let's go ahead and get started. We're going to, hopefully you all received the draft of the Preschool Promise Statement of Work, which combines the positions of the Quality Improvement Specialist and Instructional Coach. Andy, John, and Dana have been working hard on this, and they're all here to talk through it. Knowing you just got it this morning, I'm guessing some of you haven't had a chance to dive into it, but please know you got it as soon as we had it ready to go. So I think, Andy, do you want to start with giving kind of an overview and maybe highlights, and then we could move into some clarifying questions and deeper discussion. Would that work?
Yeah, that works.
Okay.
I can go ahead and do that, and then I just invite John and Dana to jump in also with any other clarifying overviews. So again, what you got this morning, just to emphasize, is a draft. This is what we feel is very close to our final draft, but I know that there's also already I've recognized that there's at least one typo in there that I need to go back and fix. So there are still things that we are adjusting on this, but it does, we feel, give you an idea of the two roles and what to start thinking of when you're thinking of how these roles fit into the overall umbrella of the work that your staff are doing with providers. And so just to go back, a little bit of background, the intent of these two roles is to support the implementation of Preschool Promise in your region. So the two roles are separate but very similar. You'll see one is a Preschool Promise Specialist. This role, I think, can most easily be aligned with the Infant Toddler Specialist roles that were brought in to support Baby Promise in some of your agencies. And that really is, when you're thinking about the umbrella of technical assistance, our vision of this Preschool Promise Specialist role is around consultation. So really helping those QISs with the basic implementation of Preschool Promise. And just to remind everybody that implementing Preschool Promise looks a lot like Spark, and that is really where we see the alignment between Preschool Promise and those CCRRs. Is that, remember that for the last few years, the quality requirements for Preschool Promise were firmly based within Spark. So it is a program that CCRRs are set up to be specialists in. So the Preschool Promise specialist will focus on the consultation around that. So providing ongoing consultation and support around learning environment setup. You see there mission setting and articulation, helping programs with orientation for children and families, curriculum models, child screenings and assessments, interactions. A lot of these are very similar to the work that they're already doing with other providers, including the inclusionary practices and business acumen. So that would be sort of the umbrella of the Preschool Promise Specialist role. And then we have a Preschool Promise coaching role, and that is somebody who takes that relationship, supporting the implementation of Preschool Promise into what is the most intense form of technical assistance, which is coaching. So these folks would be able to use practice-based coaching approaches. They would be able to meet with providers, provide feedback, observations, set some specific coaching goals, and those parts. Oh, look, thank you, Margie. I told you, it's still a draft. There's still going to be these little teeny typos we're going to find. And so keep that in mind as you go through it. So that would be the main difference between those roles. I think as we roll this out this year, I'm really looking forward to the partnership with this group and the parallel learning of how these roles are implemented and understanding better how to articulate the similarities between the two roles as well as the differences between the two roles. Some of the things that I know that we are still working on our end is to help start the articulation of how they begin their relationships with providers and how to prioritize Preschool Promise providers in their interactions. You know, when is somebody ready for coaching? When is it consultation? Who are the ones that we need to be reaching out to? Who are the ones who we know are getting supports from either they're located within an OPK Head Start or a school district? So some of these things we're going to learn together. And I'm looking forward to that experience, like I said, of that parallel learning of the implementation. This grant amendment is for 1 year, and so we will have an opportunity to put our learning into action and create some data-driven decisions in terms of where revisions may need to be. One thing I do want to point out is right here at the very bottom, you'll see number 13. This is for our coaches. So the coaches will be provided a mentor coach by the ELD. This will be somebody who the ELD is going to contract with, so not an ELD employee, and this person will coach the coaches so that coaches are receiving ongoing professional development. And the other thing that is to note, and especially in light of the previous conversation with Joan earlier, is that we are asking the Preschool Promise specialist to conduct a Preschool Promise focused childcare network, a Preschool Promise network. And obviously those are details that we'll need to look more closely at as the situations externally may be changing. But I wanted to highlight those two things. As I mentioned last week, we will be working on creating onboarding procedures for these two roles into Preschool Promise so that we're giving them a foundational knowledge of Preschool Promise as we are asking it to be implemented for this program year. We do have 179 Preschool Promise grantees this program year that we are in process of finalizing those contracts. So some of that number may shift slightly, but also the slots that are within those 179 providers may also shift slightly as we finalize those contracts. Once contracts are finalized and we are done, wrapped up on that, my intention is to provide to the CCRNRs information on who are the preschool providers, Preschool Promise providers in your region, and some basic information around those providers. So were they Preschool Promise before? Are they new? How many slots are they? Are they in school district, Head Start? And some additional information that we have gathered from the RFA process, but also our process for learning more about these programs to support startup funds and CQI funds that we may be providing to them. I am open if you have other things that you think would be helpful for your staff to know ahead of time about the providers, so please email me and let me know, and we can also include that in sort of these welcoming profiles that I'm hoping to put together for you all. I know it will take time to hire these positions, and we, like I said last time, we are looking at our orientation to Preschool Promise with that in mind. We will do several of them, I suspect. I don't think that we're going to be able to get everybody in one group at the one time, but we'll continue to do that, and then we'll continue to be available to support the understanding of Preschool Promise for increased implementation. I don't know if John or Dana want to add anything.
Hey folks, this is John. I don't want to cut off Dana if she wanted to chime in. I don't hear it, so I'll just talk until she does cut me off. Sorry, I'm straddling 2 meetings today and came on specifically for this particular topic. But I really want to stress that this body of work that we're trying to maneuver toward you is the timing, as you probably are all very keenly aware of, is going to be tenuous. I mean, we have to get you engaged with preschool promise providers as we're trying to get our funding amendments to you and get you the money that you need in order to hire these folks. And I think the thing that we're really going to need to troubleshoot with each one of you as grantees is, how do we bridge this during this period of time so that there is a seamless transition into the activities and you being able to hire, the additional staff that you need in order to support the programs. But the last thing we want to have happen is preschool promise programs getting their funding and looking toward an October date to start implementing preschool promise and not have any TA or support from the CCRR system. And so I just want to think through these things, and I don't think we're going to get to answers today, but I really want to troubleshoot with your teams how we can ensure that there is some sort of a stopgap of support for those preschool promise programs. And you guys are working with some of the preschool promise programs already. Some of them are family childcare providers or center-based providers that are in your networks. Some of them are school districts that you are aligned with and have relationships with, or Head Start programs or otherwise. But I just think that it's going to be critically important to have someone that's point on this, even in the interim as we're moving forward. And I know that that's not an easy task to divert people's attention, but this is something that we want to make sure is as seamless as possible, and that without too much stress on the system, we're ensuring that you guys are seen as the exact people that are going to be providing the supports, even if the people haven't been identified that are going to be permanently in those positions. The CCRR itself needs to be seen as the system that's going to support preschool promise programs. So the timing of those amendments, we are integrating this in with some additional resources and opportunities that are coming to CCRRs. We're trying to work with our procurement process to figure out if amendments are going to come in as separate components or all in one. But I think the piece that you want to know is that we're working as fast and as rapidly as we possibly can. And so Margie and I are meeting this week and working on the full breadth of this set of amendments, and are going to try and get this pushed through as quickly as we possibly can. So I'm sure there are questions, and so I'll pause there.
So Shannon, you have a question in the chat box and your hand is up. So you want to go?
Sorry, the other one, can you hear me?
Yes, yes.
Don't worry about the one, I can get the other one on the chat box later, but so I have staff that are currently running networks who could switch to these two positions no problem. If we're going to be losing networks, maybe. I'd rather have keep the staff I have and then hire new ones and let go of my old. So is that something we could think about? Or I think, because the timeline's killing me, I don't know how this is all going to play out, and I'm sure most of us don't, but I'd rather keep the staff that I know could do this than have to hire, just throwing that out there.
Joan.
Yeah, I just happy to have you add on, Andy, but I guess I just want to say that I'm imagining, Shannon, that others may feel similarly to you. I'm seeing some heads nod. And I am really hopeful that we're going to have a better picture of the situation related to the focused childcare networks very soon, like enough to be able to advise you on a course of action related to that. Meeting with the budget person from ODE and our internal budget person tomorrow to be able to have some more conversation. So I appreciate the tension, you know, that you're describing, and we're going to try to decrease that. And of course, we would always want you to hire or put into positions the most qualified people, right? So for me, that's both evaluating your current staff against what these positions will actually need to do and the skills. And, you know, I'm assuming all of you would do that with a very objective eye, because this is also an opportunity to make sure we've got a really good match. In particular, I think really thinking about this interface with schools, we want to make sure that the people that are in these positions have face validity, is what I would call it, with schools in particular. So in my experience, that means the person has to have a degree as a minimum. You know, that may be different in parts of where you live in Oregon and where you work, but that in my experience, those are just some things that we really need to think about with some of these positions that we're talking about. So, and then John and I talked before this call, that's one of the reasons why he was talking about the stopgap, is that in all likelihood, there is going to be a need to be working with these preschool promise providers before these amendments are fully baked, just being realistic. And so we may need this stopgap where, like he said, we don't want there to be any kind of feeling of the R&Rs aren't ready to support preschool promise providers. Like, we believe you're ready now. We're just trying to build your capacity to do that. And so that might mean, even if you don't plan for these staff to assume these positions, we may have to have you dedicate some staff time in the interim to support them until we can get new staff on board. I'm sure this isn't, you know, these are all things that you can understand. We don't want there to be any sense that you're not ready to do this, because we believe you are. And then we're trying to build your capacity to do it as fully and as ably as we know you want to.
Thank you, Joan. We do have some things in the chat, and I'd like to go through them. Shannon did have a question, just confirming that the positions are funded for 1 year, correct?
Well, because these are SSA dollars, student success dollars. So what we have to spend is what was collected in the corporate activities tax and what we were allowed, what we were given budget authority over. But we don't, it's at this point, the early learning account budget items were determined by the legislature. You'll remember, right? So how much money got to go to preschool promise, how much money OPK, like those were legislative decisions. And then when we found out how much spending authority we were going to have, we applied those same distinctions, the same apportionment of those to what we had. So we don't have any intention of wanting this to be removed from SSA. We think these positions are important in an ongoing way, but all we can do at this point is the 1 year, because that's what we have the revenue for, if that makes sense to people. It's kind of a bit tricky in that way. It doesn't imply a lack of commitment beyond a year. It's just that we don't know that we have the financial resources beyond this time.
Thanks, Joan. We do have, I'm going to keep going down the list, and I'll definitely get your hands. Those of you who have raised your hands. Karen Prow is asking about additional resources coming our way. And I believe, Karen, what you heard, the SSA funds definitely, are those additional resources. Are there any others that, aside from CCDF?
We do have some opportunity. I think you were aware that in the biennial budget, there was some funding to help to expand the CCR and to support the capacity building in the CCR&R network. And so we'll be able to communicate about that with all of you very soon. And then we did get some spending authority over a part of some fiscal year 2020 discretionary CCDF dollars that we will also be speaking to you about. So our intention is both to fund these positions at different FTE percentages based, as you've been heard already about how that's going to work. And then there will be some additional funding coming to every CCRR, a different, depending on your situation, related to this larger capacity building. And our intention is to, as John was saying, we're trying to determine right now whether that would be a single or multiple amendments, but we'll be able to do some forecasting for you very soon about what that's going to look like.
Thank you, Joan. And Eva points out, and actually I think you also touched on it, Joan, is the language that we can share about CCRR's role in supporting Preschool Promise, specifically around some of the school districts not quite knowing where to go since the hubs have changed their role. So I would like to, Karen Hinkemeyer, you've been waiting, so would you want to move forward with your question and comment?
Yeah, so depending upon when amendments actually come so that we can hire, if we're asked to do this piece of work, we need to take something off of the table or switch in some way where we can lessen the load on our QISs that we currently have employed. Or we need to support them in overtime in order to meet all of these specific things that are required of us. That's one thing. Second thing is, I appreciate the information coming out about these particular job titles, right? But we need to look at, one, are SCAs going to be, their pay rates, are they going to differentiate between a Preschool Promise individual and a QIS? And just the understanding that not one person fits all these boxes, right? And so how we work in Washington County is we are all cross-trained in things, and each individual has specific strengths that create a well-rounded team. So we may not have a particular person that jumps in this role. We may have two people that take on portions of this role. So not to be narrowed into this is all you do, right? So just understanding that that's how I view this, and that's how I feel my team works best, is we're all in it together, we all understand what's going on, and those that have particular strengths do particular tasks. Does that make sense?
It does make sense, but obviously we're going to need to have individual conversations. Karen, we're not deciding that's how it's going to work for everybody today, or I'm not even implying that it's exactly, we're going to meet you with exactly what you want. I just want you to know that I understand what you're saying and I appreciate your perspective.
Okay, thank you. Shannon, you've been waiting, and then Karen Prow, you want to have a follow-up question and comment. So Shannon, and then Karen.
So this probably would be a future discussion, or so, I mean, don't stress that it has to be answered this second, but I know based on all this too, it all fits together, is the compete part of all this. I've been getting questions in the community, like when they're gonna start that process, and because it's usually give us a year to work on things like that and get. I know there's so much going on right now, but I know I'm just getting questions, and if I could, we could discuss it later. That would be appreciative, because I think it all fits with what's going on even now with staffing and Preschool Promise and the future. Mm-hmm. And we all know that everybody starts asking now.
Yeah, thank you, Shannon. Thanks for that reminder. Karen Prow.
Oh, that's a hard one to follow, Shannon.
I know.
So with our agency's budget is getting revised right now with the addition of the OPK dollars, the Head Start expansion, and the pay rates changing with Head Start employees within our agency. That is impacting childcare resource wages because of the way we do our wage scale here. And so our budget is going to be drastically changing. And so my question around other resources coming our way, I'm wondering if we have any additional resources that are coming to us to help us with the just gap in our budget right now based on those wage increases. And I know that we've had a hard time competing in the past as far as competitive wages for childcare resource and referral staff. And I've noticed turnover around the state because of what we're able to pay. And so just a bigger question about will there be resources allocated to us that might help us solve that issue coming up that are not earmarked for specific projects?
I don't think we can really answer that. I don't feel like I could give you the most accurate information quite yet, Karen. And I think the OPK situation, and I guess Preschool Promise to some degree, it's complicated by the fact that the legislature mandated those wage increases. Like, it's a very different situation. So I appreciate what you're saying, and I understand. We're hearing about the implications of wage increases for OPK is affecting agencies all over the state. For example, I think that I'm also responsible for supervising healthy families, and the same thing is happening. Many organizations that operate healthy families also operate OPK. So obviously we know that wages in our field do need to be improved. And we know that it's difficult to be competitive. We're just in a little bit of a different situation because of how those wage increases were put into play, was legislatively mandated. So that's very different for us than what you're discussing. But I appreciate it, and I'm sure we'll want to talk with you, all of you, more about that as we go forward.
Thank you. Jerry.
So I'm wondering what's the timeline for getting the FTE associated with these positions for our region, and also the funding amount. I can actually do a lot of preliminary stuff for hiring without my amendment, but I can't do it without those two things. So I need those. That's one question, and then I have another.
I think the timeline is relatively soon. I'm looking at Andy and Dana. I think we're very close to being able to talk about assigned FTE and budget. Are you agreeing, yeah. Andy? I see you nodding your head.
Yeah, I am in agreement that we are extremely close to that portion. We just need a couple more approvals and double checks.
Yeah. And then as soon I'm hoping, Jerry, that I'm talking about something like less than 2 weeks from now, perhaps even next week. As soon as we have those approvals, we'll be able to share that information with you, and we will do that ahead of the amendments.
Okay, and so these jobs will have to go through a classing situation. So as soon as those position descriptions become finalized, that will also be an important piece. Mm-hmm. I did want to share that what we're doing in the interim is that we have set up for, I believe it's next week, a meeting with our 9 new Preschool Promise awardees, with the Early Learning Hub, a meet and greet. And so we're going to all just do a Zoom call, talk about what we all kind of know about Preschool Promise on our different parts of the elephant, and do a little rah-rah about how we're all in this together, that sometimes when we do something new, it's messy, but this is going to be awesome. And the Early Learning Hub is going to describe what they know about coordinated enrollment, and CCRR is going to talk about what they do. We're going to put some names and faces together. We have one of our CCRR staff has been on another grant half-time that just ended, and so we are moving her to be our point person for Preschool Promise. So I know other people don't necessarily have that shift, but at least in the short term, we do have a half-time person who is going to be our point person, and she has completed Lead, Learn, Excel, and done all of she's, you know, a master trainer, et cetera. So I think we're fortunate that way, but that's how we're flying right now. But I agree with everyone else. When you take on more work, you always are letting something else not happen. So the conversations that we've had about priorities have been great in that we've done a lot of really good talking about how we do things. It hasn't done much about setting priorities. It's been great in terms of understanding what we do, how we do it, learning from other people. But, you know, it's like all of it. I mean, there's very few things on our list of things that we do that we have said, oh yeah, that's set aside for right now. The majority of things have just become more intense. So just a little perspective on all of it.
Yeah, that's so true, Jerry. It shows how much more you're doing and what you have not put aside. Exactly. Because it's just all encompassing. Thank you. So we do have a few things in the chat box I think are important to point out. It does sound like it's kind of consistent as far as in the CCRRs, especially connected to Head Start, losing staff for the higher wages. And then also just a thing to point out that, you know, for geographic distances, it's hard for people to have a single role because they have so much travel to do, as well as full-time. Finding people for half-time is more difficult than, of course, finding full-time. So all points noted. Thank you so much for sharing that. I'm looking to see if any other hands are raised. I see Dana is on.
Yeah.
I want to make sure, Dana, you have a chance to provide any other clarifying information.
Yeah, totally. So this is Dana. So I mean, really, Andy and John are, you know, the leads here with, you know, the work with our CCRR, so working really closely with them. I think just a couple things, you know, where I really see our next implementation for Preschool Promise is that where you guys will go ahead and play a really vital role is really just sharing the message to our providers that, you know, the technical assistance that they're going to be getting is really expanding, right? I mean, they're going to be getting support from the hubs. They're going to be getting support from the CCRRs. Here at the ELD, there's going to be some support available. So while things may have been a little rocky within the past year, I think, you know, as we see the full implementation with Preschool Promise, is like this is a win for providers because they are getting a lot more resources to go ahead and really fully implement Preschool Promise. You know, we think about even with coordinated enrollment and previous implementation, the provider had to do a lot of that, you know, paperwork and all of that. You think about our, you know, even with technical assistance, a lot of our hubs had to deal with insurance and contracts and all that. We don't have that. So I think as we move forward, it's really just looking at this very holistic approach where the hubs are involved, the ELD is involved, the CCRs are involved. So we really, I would just go ahead and echo, help us be those, you know, marketers out there in community and letting that, you know, just sharing with the providers that we want them to be successful, which is why we're grabbing so many different partners. Each of our Preschool Promise grantees is going to be given what we call a grant manual. On that manual, I think we heard you at the last meeting when you said, well, does it say there that they have to, well, not that they have to, but does it say there that they are going to be supported by the CCRRs, and what happens if providers don't want our technical assistance? So we were able to go ahead and include that language in the grant manual. that says that there's are resources available. The expectation is that they were in collaboration with the CCRNR. So we were able to go ahead and add that in there. That grant manual is going to be a really nice tool for CCRNRs because in them is going to be the preschool promise quality requirements, which a lot of their staff are going to be providing support on. So we are really looking at a nice, holistic, really full kind of a process to be successful with preschool promise. The only thing that comes to mind here, and I do have to go ahead and jump off, would be that as you are trying to go ahead and make those decisions for hiring and how is that going to work, and you're having conversations with Margie, I'm thinking like we need to know like who will be that contact at the CCRNRs for this provider. So as we are talking to the providers ourselves, we can go ahead and say like who is the main contact at the CCRNRs, just the same thing with the hubs and just the same thing with us. So that way grantees know who to contact. So while you may not know who's going to be the preschool specialist, preschool parent specialist or coach, we do, I will go ahead and echo, let's go ahead and at least say who is that main contact at the CCRNR that preschool promise can call, even on the interim while some of these decisions are being made. But thank you all. This has been really wonderful. So I'm really excited and yeah, looking forward to more. And I'm sure there's more questions and stuff that come up. So thank you.
Thanks, Dana.
I did want to add to what Dana said, that we actually got a couple sentences in the actual grant agreement about working with the CCRNR as well. So and the hub is in there too. So as providers are signing that grant agreement, they are agreeing that they will be working with the hubs around coordinated enrollment and with the CCRNRs related to technical assistance and that kind of support. So we're trying to set the stage to address making sure that people understand that, but obviously the proof is in the implementation of that, and that's why it's so important that we can set you up as the folks that they want to be in touch with as soon as we are able to make our final decisions and go ahead and issue grant agreements, and once people have actually signed their grant agreements, because we're still in a anything is possible phase at this point, because people may not just decide once they see the agreement to sign it. So I think just to say, I think what Jerry's describing is fine. A meet and greet is great, and that everyone should just be acting like we're still in the space where we do not have a legally binding agreement between ourselves and any of these providers yet, just intention. And that's positive and good, but we should just keep that in mind.
Thank you. So Mary Wolf.
I have a question. We've been getting already, I've gotten quite a few emails from Preschool Promise providers. And my question is about the emergency childcare. So if a provider was planning to have a group, say of 18 with a lead teacher and an assistant, and now if it continues with the new guidance that they have to have that stable group of 10, what steps should they be taking going forward? Or is there guidance around there? They might not have another room that they could put that second group in.
Right. I think that we all need to make it to Thursday when people can see the guidance around group size.
Okay.
And I think that is going to answer a lot of questions.
All right. That sounds good, Joan.
Thanks, Joan. Thanks, Mary.
This is Dana. One thing to add for all of you CCRNRs, and I'll go ahead and put it here, whenever you're getting questions related to the intent to work, because that question has come up a lot. And I will echo what Joan is saying, is it's only an intent to work. So I have heard from some grantees actually waiting for those revisions to go ahead and come out in answers to these questions, whether they want to go ahead and sign their contract or not. So just let's go ahead and all that, like kind of keep that in mind. But whenever you are getting questions from a grantee, please direct them to that to the email that we have available here at the Early Learning, because that allows us to say, okay, this grantee is having this question. Let's go ahead and answer it. Sometimes, as you can see, we're like really busy, but I'll go ahead and add that to the chat box here before I leave. Ready? But thank you. Jump off.
Great, thank you. And it looks like Angela put the email address in there. Thank you, Angela. And I guess there definitely, it looks like the directors are going to set up a meeting, and Taya shared that you've been doing this work with your hub through a contract, and you're going to connect with everyone to talk about lessons learned. That's really wonderful. Are there any other questions, comments? Andy or John, anything you want to add?
I think I would just address, I thought Eva had a question about when the Preschool Promise Manual will be ready, and I know that is ongoing work. Like there's folks working on it right now to finalize some of the last legal portions of that. Obviously, the goal is to have that ready by the time that we are doing contract signing, which will happen after the appeal process has wrapped up. So the appeals were due earlier this week. We are now currently putting those together so that they can go to Miriam and to the Early Learning Council, who will be deciding on those appeals. And then after that portion, then we'll be entering the contract negotiation phase of getting these contracts finalized. And that's when, once the contract is finalized, they will get their grant manual. So we have a firm deadline around that, but obviously we want to get that out there sooner rather than later. And what I can say is that for the CCRNRs, in addition to the grant manual, you'll be getting an additional guidance document that will go hand in hand with the program quality expectations in the manual, just to help provide a little bit more of a context in what this looks like in practice, which will hopefully support the work that you do with the Preschool Promise providers.
Great, thank you, Andy. Are there any other questions? Just to sum up, more information is coming soon. Your amendments will be coming soon. Information on your FTEs will be coming soon, your budgets. We will most likely reach out individually to talk about those details, so do expect to hear from us. And we'll have a conversation to go over everything that you will be getting added, that will be added to your amendments. Is there anything else? Okay, well, it looks like we can end early. Thank you, everyone, for all of your work. Thanks, Andy and John and Dana, for the hard work you've done on the Preschool Promise positions and the draft statement of work we've been able to get out. And thanks, everyone, for all of your feedback. You will be getting, Joan, 4 names, it sounds like, fairly soon to be able to talk about the revisions, correct? Okay. And Mary's suggesting we stay on for a quick meeting. The only thing is, Mary, it's my go-to meeting, so unless you want me to stay with you, you might need to do a separate Zoom or go-to meeting link. Looks like Hannah can send a link. Okay, great. Thanks, everyone. Have a great rest of your day. Bye.
Bye, thank you.
Thanks.